Hello, my name is William Chachek. I am here to address you on a very important, wide-ranging issue that affects the livelihood of all Canadians. What I'm referring to, of course, is health, fitness, and the subsequent nutritional education of our population, both young and old. According to the Canadian Health Measures Survey, between 1981 and 2009, fitness levels among our children, youth, and adults all significantly dropped. Calculated by BMI or Body Mass Index, this shows that Canadian adults have gotten heavier over the past 25 years. Statistics Canada has reported that during the 2007 and 2009 periods, under 38% of Canadian adults were actually at a healthy weight, while 37% were overweight and 24% were obese. That's 61% of our Canadian population who are classified as overweight. If you think about it, that is 6 out of every 10 people that are headed for long-term illness or complications. Let's examine this. The Canadian Fitness and Lifestyle Research Institute has claimed that Canada's total healthcare spending in 2003 was estimated at $121.4 billion, or about 10% of our gross domestic product. The total cost of illness in Canada in 1998 alone was $159.4 billion, or 52.7% of our GDP. Current estimates say the cost of Canadian physical inactivity is at $5.3 billion, and the cost of obesity in Canada alone is $4.3 billion annually. That's roughly $9.6 billion of our tax dollars being spent yearly because we as Canadians are simply not active enough.
I'm Renee Primo from the Fitness Forum in London, Ontario. I'm here to talk to you about how important it is for children to start young with health and fitness. If parents can introduce their children to health and fitness by involving them in making their meals and showing them how important it is to work out by doing it themselves, then those habits can be instilled in them from a young age, and as they get older they'll carry over to other parts of their life.
Since 1942, Health Canada has helped Canadians make healthy choices by publishing a food guide. In 2007, it was finally mandated that all food products must have an ingredients list and a nutritional value chart. Nutritional education is very important because it affects the livelihood of all Canadians. Excess fat consumption peaks among people aged 31 to 50. More than 1/4 of men and women of these ages derive more than 35% of their total daily calories from fat alone. Among teenage boys aged 15 to 19, since 1981, the proportion of those classified as overweight went from 14 to an astounding 31%. Among teenage girls, it rose from 14 to 25%. Total screen time among our Canadian youth in grades 6 to 10 is roughly 7 hours and 25 minutes a day on weekends and 5 hours and 56 minutes a day on weekdays. Sport participation rates in Canadian youth aged 15 to 18 declined from 77% to 59% between 1992 and 2005.
My name is Farah Eldahar. I teach here sociology at Fanshawe. And I guess the question is how are sports beneficial for society? How are sports good on a sociological level? And there's so many ways you can look at this. Sports are good for the development of children, obviously. Things like cooperative skills come out through sports, physical fitness, team skills, working with others. All of these things are very beneficial for society if they're instilled in our children from a young age. They grow up with them, and since there's not enough physical activity in the school system now, we see how that can translate to problems on a societal scale. It's good for adolescents because it gets them away from troublemaking and time wasting. So when they're involved in sports, they have something to do, and it's positive and gets them away from aggression, and it allows them to express themselves and get out all that pent-up energy that they have so much of. And for adults, it's about keeping fit, and it's about being healthy, and it's about eliminating all potential for physical illnesses that come with older age. And so really on all age levels, sports is very, very important.
Participaction was a non-profit organization that became a program in 1971. It was funded by the Canadian government. It gained popularity through the late 80s and early 90s with a series of innovative commercials called Body Break.
Johnson and Joanne McLeod. Whether it's here in Alberta or on the East Coast, cross-country skiing is one activity that'll get...
With generous support from Sport Canada and the Public Health Agency of Canada, Participaction was revitalized in 2007 as the national voice of physical activity and sport participation in Canada. As suggested by Participaction, a potential solution is regular physical activity, which is associated with as much as a 30% reduction in all causes of mortality rates. The United States has recently introduced some progressive legislation in terms of regulating what foods are being served at schools and also mandating more physical activity amongst their youth. I ask that the Canadian government put aside partisan politics, stop talking, and start taking action. Begin funding of AAU and other grassroots programs. Please regulate the foods that's being served to our children in preschool and public schools, and increase the funding in public and high school of extracurricular athletic activities, and mandate curriculums to include health and fitness and nutritional education. We must take pride in the health of our entire population to ensure for a strong and unified Canadian society. Thank you for your time and concern. This message was brought to you by the Canadian Council of Active Living and Parents United for Healthy Canadian Children.